guys, and welcome to episode 155 of the OCDstories.com podcast. Now in this episode I got on Katia Moritz, who is a clinical director at the Neurobehavioral Institute in Florida. She's a licensed psychologist who treats OCD. And it was great to get her on. We covered many things in this episode. It was really great to talk with her. Some of the things we discussed is kind of her story, why she got into treating OCD, which is really fascinating. Her book, Blink, Blink, Klopp, Klopp, which is a children's book using storytelling to help children understand OCD and OCD treatment. We talk about the early detection of OCD in children and how to change that through information and educating schools and teachers. We talk about a concept that she created, the ranch, which is a place based in nature. It's a community where obviously they do therapy for OCD, but also other things like rope courses, equine therapy, which is horses, organic gardening and other activities, just learning to live again. We talk about the concept of learning to live again as well, beyond that, which was interesting. We talk about family interventions, when an intervention is needed and what one is. She gives advice for parents. She answers the question about learning to live with uncertainty, and I really like the response here. And the importance of giving, giving of your time, giving of your character, money if you wish, and how giving can create a meaningful life. And towards the end, she talks about how it takes a village to treat OCD, and I thought that was a really fascinating concept. We discussed so much more in this episode. I really enjoyed talking with Katia, and I think you'll enjoy listening. So thank you as always. And without further ado, here's Katia. On the podcast today, I have Katia Moritz. Katia is a clinical director of the Neurobehavioral Institute in Florida and is a licensed psychologist who treats OCD. She also wrote the children's OCD book, Blink, Blink, Klopp, Klopp. Welcome to the show, Katia.
Thank you, Stu. Thank you so much for having me.
It's good to have you on. And as I always get people's story, whether it's an OCD story or whether it's why they got into treating OCD, so it'd be good to get your therapy story.
So my therapy story is a story of immigration. When I was studying to be a psychologist in Brazil, I one day went out to dinner and I saw a man come in to dinner with his mom, and he didn't eat his meal. He was doing all kinds of things with his hands and moving the plate and moving the cup. And I couldn't eat either because I was fascinated. I couldn't understand what could that be. He wasn't schizophrenic. He wasn't, it wasn't like physically he couldn't eat the food, but he couldn't eat his food. And luckily for me, I was under the supervision of the only cognitive behavioral psychologist in Brazil, in Rio at the time, who ended up becoming my mentor. And I went to him and said, what is that? I mean, that's amazing. And he's like, well, that's OCD, and CBT is the right treatment for it. And that moment changed my life. I was like, oh my gosh, this is what I'm going to do. I'm going to treat OCD. And then coincidentally, a month later, we start getting assigned the cases in the clinic. And guess what? My first case, a woman with OCD. And I went to my supervisor and I said, listen, she has real OCD. It's a real issue right now. You have to treat her. You can't let me treat her. And at that time, we called obsessive compulsive neurosis. And we did the treatment, and that was 1990. I know it's a long time ago. You weren't even born. Oh, you were born. No, that's good. And it was an amazing thing because she did get better. And I kept my de-identified notes. And the other day at the office, I actually share with my staff my notes from this first time that I ever seen a patient with OCD. And because of this person that I saw at the restaurant, I decided that I had to leave Brazil and my family and my friends, and I immigrated to America. Luckily for me, I became a visiting professional at the Albert Ellis Institute. And when I was there, I met Dr. Fugen Nizzarolo, who became my mentor, and Dr. Yayura Tobias. And I ended up working for them for many years and going to graduate school while working for them. So OCD actually changed my life and my whole perception of what's important and what I needed to do. It gave me direction, and since then I'm obsessed with it.
Brilliant. And we're going to cover many topics today, but first of all, I thought we could go into children. So you wrote the book Blink, Blink, Klopp, Klopp, and it'd be good to kind of hear more about that and why write it.
When I started treating OCD, I realized I really wasn't good at treating pediatric OCD. Those little guys were big challenges for me. I still remember this little boy who gave me a run for my money, and he would lay on the floor and cry and scream, and I felt so bad and felt like, oh my God, I'm doing such a bad job. And I realized that, hey, if I'm doing a bad job, I need to learn how to do this better. So I really developed this passion for developing materials for pediatric OCD and really teaching kids about OCD very early on so they learn how to fight. They know their symptoms, they're aware. And I really believe that that impact early on could change the course of OCD. So I was doing my research. I wrote a manualized treatment that used games to do the exposures. And I don't even tell you when, it was like 20 some years ago. And I realized that I didn't have at that time materials to really teach OCD to kids. And I didn't want to do something like formal. And I felt like if I created a character and a story around it, it would make kids understand. So I created a character called the OC Flea. And the OC Flea went around the farm giving OCD to the different animals. Some animals were predisposed, some were not. And through that story, I was able to explain kind of OCD and symptoms, but also cognitive behavioral therapy. So eventually the animals kind of figure out that something is going on. And then there's a storm that goes through the farm, which was my response prevention. And they learned about CBT and how during the storm, the animals were very distressed. They couldn't do their compulsions, but then later learned that that's the way to get better. So the book was, something really cute that I loved. And I still have some adults and teenagers that totally dig it. They like it. They want to use it in therapy. And it's a great way to really teach early on about OCD. I love when I go to the IOCDF conference, and there are a bunch of kids that I don't know, and some of them are from Wyoming, every state and far away, and they're talking about the OC Flea, and that makes me really happy. It makes all the work put into the book make sense to me.
Yeah. No, thank you for that. Well, I got my copy today, so I look forward to reading it.
Yeah, I like the story. It makes sense to me still after all this years, so it's good.
Good. And when you started to write that, to kind of get those kids to understand better, do they kind of get it much quicker when they see it and start to read it as opposed to when you're just trying to talk it through with them?
Yeah, I think that it just, like sometimes it's hard to hear from someone, and to explain OCD to a younger kid is difficult, and when they reach to the story, they're like, oh, I have that and I do that. And, oh, I'm like the horse, or I'm like the cow, or I'm like the chicken, and so I actually sometimes use this as an identifier for some of the symptoms. And I've had kids where they are presenting with one symptom, and after they read the book, they actually say, hey, I had this in the past, and oh, I have this right now, and I didn't even know was a symptom, right? Yeah. So I find that it's a good way to get to the information, but also it demystify the whole thing, because it's a Farmer Brown story. It's kind of cute, and the OC Flea looks cute, and he has arms, and many of them, and he looks like skeevy, and I think the kids connect with the character, and so I think it's a good way to get the story across to them, and also not only the story, but how do you fight it, and what is the treatment all about, right?
Yeah, it makes a lot of sense. And I think having it OCD as the flea makes it less scary and less daunting and something more manageable, because it's just a flea.
Right, and it separates you from the symptoms, right? So who is OC Flea is giving you that. And so we actually at the clinic talk about what we're going to do to the OC Flea. We're going to arrest the OC Flea. We have one kid that said they're going to freeze the OC Flea, and so we're going to shrink the OC Flea. And it's like a nice way to have a visual. I usually have them color the OC Flea. We've been kind of working on having them in an OC Flea book, where they could tell their own symptoms and their stories. And we use that in the clinic a lot.
Nice. Yeah, I like it. So I noticed on your biography on the MBI website is you're passionate about early detection, which is something I care about because I think if we can detect it early enough, we can prevent years of suffering.
Absolutely.
Yes. So what are some of the ways that people can, or that you have kind of gone about early detection?
Well, I think one of the things that we do a lot at the clinic is because we incorporate family work on everything we do, a lot of the times just the education for parents allow them to notice something in a sibling, right? So when the siblings come in for the sessions with their brother or sister who suffer from OCD, we sometimes are able to identify some similar, emerging symptoms. And it's interesting to watch, like the first few symptoms, the first time that someone is engaging in a compulsion. And the difference, like you said, of changing in the beginning and preventing a lifelong suffering, just understanding yourself, the fact that you understand that that's OCD and not you, and that you could actually go against it, it's the most empowering thing we could do. And I think if I had, a dream or a vision would be that everyone in the world would know that, like we know that touching fire burns your hand, that engaging in OCD compulsions or listening to OCD messages will actually lead to a lot of pain and suffering. And so if we're able to prevent that and we're able to teach people skills and strategies early on, not only for OCD, but all the anxiety disorders in general, they function pretty much similarly to OCD, right? And so if we're able to educate that, and I have to say that over the years, I feel like the OC Foundation has done a really great job. And I remember, 28 years ago when we started to talk to schools and put out materials. And I think in the past 10 years, they've done a tremendous job at bringing education and, all this information to the public. So nowadays, instead of getting a patient with OCD 5, 10, 20 years later, sometimes, I get a 3-year-old and the parents come in and it is OCD. I mean, they are clearly showing signs of OCD, and the parents are able to differentiate OCD symptoms from normal developmental, sameness or repetitive behaviors, which is sometimes are similar, right? So I feel that education portion and programs like yours, I mean, just your podcast alone, it's super important because the information that is given to the public could really change the face of OCD in the future.
Yeah, no, I appreciate that. Thank you. And I know that the ISTF, I think, recently launched Anxiety in the Classrooms, like a course. Yeah. So hopefully that. And I know in the UK, they've just in Parliament, they've passed a bill that I think means they're going to start teaching mental health in schools.
That's so important.
Huge, yeah.
Yeah, I was just in Trinidad a few months ago, and I go to Brazil a lot. And what I do is when I'm in those countries, I, sometimes go to see patients there, but then I go ahead and kind of do education to the public and to the clinicians and all that. And I feel like, it has to be something international too. Like we have to spread the word and have people educate the people, right? Because if we pass on this education to professionals and teachers and educators and all that, that information is going to get to families, students, patients in general. And I think that's really important.
Yeah, no, absolutely. I agree. That's kind of why I like podcasting, because there's no barriers or boundaries. It's global.
Exactly.
Well, at least in sort of English speaking countries.
Right.
Although I do get a few listeners from Brazil, interestingly.
Oh, well, I believe you. I believe you. Yeah.
Hello to those guys.
Absolutely.
So I thought we'd go on to the ranch now.
Sure.
So you guys set up, and you were heavily behind this, was the MBI Ranch. So it'd be good to we'd just share kind of initially what it is.
Right. So for many, many years now, we have an intensive treatment program. And so intensive treatment for us has been kind of the core part of treatment because OCD is not the kind of condition that for most people you could treat in one session a week, right? I mean, it's really hard to do that. And so very early on, we felt that we had to do a different model. And it's not only for adults. I mean, younger children need sometimes intensive. People from out of town need intensive. And people who are busy doing their work, they need intensive. And so a lot of our treatment really focused on the intensive therapy. And as we developed that model, we started to realize that a lot of people were coming from out of state or out of the country. And we had a bunch of adults staying at a hotel with their parents, and it was like a disruption to the entire family. And also we realized that, okay, they were with us all day, but then when they went back to their house or hotel or wherever they were undoing a lot of the things that we are teaching them, or they weren't ready to be on their own. But also they really didn't need like an inpatient program or living in a hospital. They needed just a little support, right? When I lived in Utah for 2 years, and while I was there, I created this camp, like you do have one too, right? Yeah. This camp in Utah where I would take 10, 15 families all together, and we would take this facility called the National Ability Center, and we would do all the activities there, and it was amazing. I mean, all nature-based activities and exposures, and we go on the ropes course and do exposures while you're hanging on a ropes course, and you're yelling your obsessive thoughts, and you have sticky all over your face, and doing all kind of really high, so you talk about like exacerbating your anxiety, already freaking out because you're like on the highest top ropes course, series. And then on top of that, you were working on your OCD, right? And it was great. I loved doing it. We did a OC ski, and we did a few summer programs, right? Yeah. And when we did that, I realized that model was amazing. And the people that went, really the treatment was so impactful. And over time, I felt like, okay, when I moved back to Florida, I'm like, well, we should be doing that in Florida. And that's how the ranch came about. I wanted to have a place in a house that felt like home. It felt like a little ranch, where people could go in the backyard and work on the organic garden and learn to cook again and learn to live again, connect with nature. We have a great equine program that we work with as well. So working on interpersonal relationships and all the other stuff that, if you have OCD, everything gets affected by it. Yeah. So we're trying to get all the other aspects as well. So they cook, they see a dietitian, they exercise, we go boxing, we go to the Everglades, we go kayaking. I mean, there's so many fun things to do that most of the time people with OCD, they're suffering and there's so much in their head that they lost connection with the beauty in life. And nature is a great avenue to get to the beauty, right? And so we kind of combine those two things. So they are at the office from 9 to 5 doing very, very intensive work. And then at 5 o'clock, they go back to their kind of house, and which I think is helpful because it helps them with the transition when they're done. They are living in a place that feels like home. They are responsible for their laundry. They're responsible for their food. They go food shopping. They're responsible to participate in entertainment. They have to, do all kinds of things that will help them with the transition. And so it was about a 25-year dream of mine to have the ranch. If you asked me 25 years ago, I'll be saying, oh, one day I'm going to have this program and people are not going to have to be in a hospital-based program, but this cool facility that will allow them to experience life and learn to live again. And I realized that I had to do it. It was now or never. And so about a year ago, we started, but we are, it's a very small program. It's very designed for each patient individually. So we don't market as a setup program. So let's say if a person is not ready for groups, they can actually do only individual. There's a lot of accommodations to help the person get through it successfully, and they receive enormous amount of sessions and groups, and they're really, really busy, and I love it. I think it's great.
Yeah, no, that's awesome. Inspiring to see you pursuing your dreams and goals. Okay, so, and I guess as part of this, you talk about this idea of learning to live again, which I really love, and it's a big part of the podcast, which is, it's not just about OCD, there's so much more that's gone on, the collateral damage, that it's about almost being reborn without being too flowery in my wording. So I guess, why is this idea of learning to live again so important? And I guess, how can listeners generally, get the life back on track, whatever that means to them?
Yeah. So one of the things I tell people all the time is OCD hates life and happiness, right? Because if you're living your life and you're trying to do what you need to do, there's not a lot space to kind of listen to OCD. And so I feel that the best competition for OCD is to actually engage in life. And I do think that as clinicians, we need to help people get there. It's very different to say to someone that are losing weight, that want to be a marathon runner. Losing weight is not going to lead you or get you to run a marathon is a tool, but you will have to do some other things to get to run this marathon. And I think life is a lot like a marathon, and even enjoyable things and happy things are difficult for people because they're scary and everything has a risk, and you're afraid of failing, or if it's not perfect what you're going to do. And so there's so many OCD issues that affect you even doing very basic things. And I do believe that treatment has to focus on that too, because just giving someone exposure and the tools and talking to them about how to face their OCD does not really transition into a life, right? So, I mean, over the years, I've watched people get better from OCD and have a very restricted life and only do things in a certain way. And I think that the enjoyment for us is to watch the people that went from struggling so much and having very kind of small box in life to actually experience so amazing things. And they sometimes become even more daring than all of us, who treated them and so I think it's amazing, right? And I think that that's really treatment has to allow people and help people get there. And focusing only on the techniques, it's important to know them, but it's important to really take people from A to Z. So for me, treatment, good treatment looks like when you actually get all the variables in, and life has to be one of the most important of them, because being able to response prevent to a compulsion, but still avoid everything else that is enjoyable, or never be able to go on a date, or never be able to talk to friends, or not able to go to an outing or restaurant or something. It's not, to me, success all the way. And I think it's part of treatment to actually help people. So most of our treatment, and I think that was weird many years ago, where most of our treatment takes place outside of the office, where we are at restaurants, malls, airplanes, or, wherever it is. That we have to take people to really become engaged again. So I think that's our job as clinicians, to go with them. And for me, our treatment is a bit different because we do that ourselves. So I'm actually the one going with you, out there and going to the restaurants and having the sessions wherever we need to have when the person is ready. So understanding that readiness and knowing when to push and when to back off, it's really part of the art of treating OCD.
Yeah, really good answer. I believe you've been involved with some family interventions around OCD. So I guess for those that aren't aware of this, what is a family intervention, and why and when is one needed?
So we get a lot of calls from families where a patient is not willing to go to treatment, or the relationship with the family has really been changed between the children. It doesn't have to be a kid, but an adult child, and the parent, due to the symptoms of OCD, right? So OCD is so insidious that people don't realize how they started accommodating. And the rules that OCD make for the patients, they become part of the rules for the family, right? And so like the accommodation of symptoms and all these aspects of, people's feelings about their kids and trying to make them feel better, actually end up feeling more of the OCD symptoms. And it is really hard for families to understand that the treatment is going to require their child or adult child to feel anxious, to learn to deal with anxiety, right? And this is what they've been working so hard to prevent is to decrease the anxiety and to accommodate them so they don't feel uncomfortable. So this paradigm shift is so important for the patient, but also very important for the families. And sometimes the patients make that shift before the families do. It's very hard for a parent to watch their kids struggle, and sometimes the patient themselves could struggle much better. I have to say that the brave kids, little kids, like sometimes they're super brave. You give them an exposure, like, I'm doing it. Like, I don't care. I'm just going to go for it, right? The roller coaster riders. And their parents are like, no, don't do that. You're going to be upset.
Yeah.
Right? And so family work became a crucial part of what we do at MBI and at the clinic, because that really impacts the treatment outcome. And it doesn't matter if someone is 30 years old or 5 years old. When you have OCD, a lot of times the relationships haven't changed that much. And a lot of adult patients are dependent on their parents. If it's not financially, is for other issues, for other situations that OCD kind of puts you in. And so many times the family realize that this patient needs help and needs to make a significant change, and they don't know how to help or support or even push, right? So we need to put some pressure. And so, in drug addiction, people talk a lot about intervention, where people walk away and say, well, you do what you need to do, otherwise we're not part of your life. And for OCD is a bit different, but it has a little bit of the flair of like, hey, this is no longer acceptable. You are dying. You're not living life. This is not working, right? And that intervention for me is super crucial. So I can't tell you how many times I've had patients that were living in a car in the cold weather, and we got a call from a family, or a parent that benched the kid. I call benching because they set them up in an apartment and have the kid live there, fulfill all their basic needs while this person is like compulsing day and night. And the environment has allowed them to, because now they have food and shelter, and they could be there because someone is taking care of them, as opposed to using that as a pressure to say, hey, you need to fight your OCD. There is a way. And to be honest with you, that's something that upsets me a lot when I hear people say, well, there's nothing we could do for you. Just keep your child comfortable. I really don't believe that. I've never seen cases where there is an intervention. There is a way that we could get to that person. And sometimes it's pressure. Sometimes it's helping them realize that they need the pressure. Many times the patients themselves say, put the pressure on me. Don't let me go home. Don't buy food for me. Let me go and buy food for myself. Let me be independent. Let me try, right? And so that intervention to me is actually crucial to treatment, but you don't want to do it in the wrong way. And also you want to support both the parents, the families, and the patient through that process. So they need a lot of guidance. So a lot of my time is spent with families. I would say that if you look at my schedule and the schedule of treatment at the clinic, there are hours and hours and hours of a parent workshop with the patients, without the patients, sessions for the parents, sessions for the family. There's so many aspects of family work that has to be included in treatment so we can be successful.
Yeah, no, thank you for that. That was really interesting. Okay, and similar question, but slight difference. So this is just general, so it doesn't necessarily have to have got to that point where an intervention is needed. But what kind of advice or words of wisdom do you have for family members, how they can better support loved ones with OCD?
What I tell parents, family members, loved ones, anyone involved with someone who has OCD, is that you do have to become an expert on the underpinnings of how OCD works. OCD is tricky, very tricky. And the people with OCD, because they're smart and capable, sometimes they are not realizing that they're using their intelligence to manipulate their people around to help their OCD and not them, right? So people around them really need to be able to outsmart those processes and understand what their role becomes. And sometimes their role is not to make this person feel better. Most of the time it's not. And even when a kid is very little, we would say to a parent to answer to a kid something that the kid is scared of or uncomfortable with as part of the treatment. And the parents have to learn that that's actually good, that feeling uncomfortable is positive for that person, right? And so the short-term pain for the long-term gain concept is really important for families to understand, is a different philosophy. So your interaction, so if you think about it as a parent, you always want to reassure, to nurture, to make your kid feel better. And instinctively, you're going to do what they're asking you to do.
Yep.
But if their brain had been kidnapped by someone strategizing to get what they wanted from you, you would be actually helping the bad guy in a way, right? And so it's really important that families understand what is OCD, how OCD works, and really learning their role, because parents play an enormous role. And if you look at the research and you look at the treatment, even your anecdotal, experiences are that people that have parents who are really strong and learn the deal and know what to do and know how to manage really support the treatment so much more than the parents who are either, removed because it's too hard for them, or they are over involved and they're trying to solve the problems and help the person, in a way that is not helpful. So knowing how to help is crucial, and really, really affects motivation, treatment outcome, all these different things that we're trying to get as results of treatment.
Yeah. No, yeah, good answer. Okay, so a general sort of question now is advice for living with uncertainty.
Learning to live with uncertainty for me is actually the path for living a better life, and actually is the acceptance of what life is, right? The fact that you want to change something that you can't change does make your life miserable. And so all the people that have come to terms with the fact that life is uncertain, everything is uncertain, and the only way to live is to allow that to be the case and to accept that, right, have been able to live a much better life. OCD actually kidnapped that concept and say, wait, no, your job is to be certain. You need to look for all the possibilities, and there's going to be an answer there. Yeah. And so outsmarting that brain trick, is really important. And so finding that answer that in reality is not finding the answer, right? Because if you learn that you're not going to find that answer, is actually very comforting that we've been looking for something that can be found. And I think that's the core of OCD treatment, is like, you can't find it. You can spend your whole life looking for something that you're never going to get, and you're going to drive yourself really crazy and uncomfortable and dysfunctional if you continue on that path, right? So it's a hard thing to say, but learning to live with that uncertainty makes your life much better in all possible ways.
Yeah, absolutely. I can agree more. And it's a tough one, isn't it, for all humans generally, to sometimes live with uncertainty. Absolutely. With OCD even harder. But yeah, absolutely possible as well.
But I think it's the trick of OCD, right, Stu? I think that what OCD does is tells you that concept is wrong, that there is a way. If you go my way, you will reach uncertainty, right? So, I'm only like 5'2", right? And I would love to be taller. If you told me that if I follow this path, I would gain 5 inches, and I really believe it, I may do that. But if that was just a hoax and not true, and I'll spend my whole life living towards that goal that I can't achieve, that's really sad, right? So I say OCD is a bully that way, because it tricks you to believe in something that it's actually not true.
Yeah, good point. Yeah, a few other examples spring to mind as well, but no, that's a really good point. Okay, so is there anything you notice among your clients that seem to just recover quicker than others? Is there something they do, or the way they act or behave?
Yeah, the concept of white knuckling to me is really important. So for my patients that are just white knuckling to show that they did the work, and going through the exposures and going through treatment as like an obligation, I think that their recovery is slower and they go through much more bumps. I think wrapping yourself on that blanket of uncertainty and really jumping into treatment as something that really is personally rewarding, and the personal growth that comes from it. That's something I see a lot for our patients, that not only their OCD improves, but their development changes, their as people change, and they find themselves, and it's very, very beautiful to watch the whole process.
Yeah.
And I do think that the people that really immerse themselves in the concept and say, this is a moment where I have to do this. I always say, we don't go, unfortunately right now, we don't have a way to just go and fix the OCD. I know that there are surgeries and, all kinds of, DBS and things like that. But right now, when we do cognitive behavior therapy, we are coming from the outside in, right? And to do something so powerful, you need that commitment. So I feel that the patients that commit to really being nimble with the treatment and really willing to listen to something that is quite uncomfortable and it feels weird and, uncertain, right? I think those are the people that do better. But I think the people that then move on to living a life worth living, who actually engage in work and fulfilling careers and, charities and, talking to people about OCD, that let go of the shame, the stigma, and are out there in the world talking about themselves and their lives. I really do think that those people end up doing better.
Yeah, no, that's interesting. Yeah, I love asking that question. Yeah, I like the idea success leaves clues. So that question for me always, finds that secret source, so to speak.
Yeah.
Okay, so a few questions now towards the end.
Sure.
So OCD may not come into these questions, but they may. So sure. I'll leave it at that. If you could pick up the phone and call your 20-year-old self, what would you ask her?
I tell you, buckle up, girl. It's going to be quite a ride.
A good ride or a bad ride?
Every ride is a good ride.
That's true,
as long as you don't completely crash, every ride is a good ride. So it's a very, very interesting life. It's, again, embrace it, be courageous, take your steps, do what you feel you need to do. I would totally just take a chance. I would say take a chance.
Yeah, love it. Okay, cool. Next question is, you have a billboard in Florida. Obviously, I realize Florida is a big place, but you pick where
sure.
it is. What do you want written on that billboard for everyone to see?
I would love people to know how good it feels to help other people. If you're looking for the mission, the reason, what makes you happy in life is actually giving. So give to others, give of yourself, think of others, give. I would say give. And it doesn't have to be about money. It's just to give, just to, be able to touch a life every day. For me, if I could touch a life every day in any way possible, if I can contribute to anyone, that would be something that makes sense to me in life.
Yeah, couldn't agree more. I feel the same way. Okay, and is there anything else that I haven't asked you that you wish you could have shared today?
That I wish I could share today. I think it takes a village to treat OCD. I don't believe that alone we could do this. I don't believe that alone in an office people could actually do the work. I do think that people need to learn to collaborate and support each other. I do think that there is a beauty in teamwork. I love that concept of teamwork for OCD. OCD is so complex, so convoluted. 28 years later, and I am telling you that I learned every day. Anytime that we get a new case at the clinic, I feel the same excitement I felt when I took my first OCD case. Yeah. The same anxiety, the same let's figure this out feeling, And I can't imagine that being done on your own, right? So I do believe that it takes a village. It takes families, it takes doctors, it takes teachers, co-workers, bosses. It takes a whole village together to help someone, overcome the symptoms of OCD. And to me, I have so much respect for OCD sufferers. Just watching them with the struggles, go through the pain, work on themselves, get on the other side of that scary bridge that they have to cross, I'm so proud every day. It's just, I can't get enough of that. It's just that watching that process to me is so beautiful. And I wish people had the opportunity to watch that happen. It's really a beautiful process.
Yeah. No, yeah. I love it. It's great to hear that you're learning every day. That shows you still care.
You have to. You have to. Yeah, we have to for sure. Otherwise, it wouldn't make any sense.
No, that's a good point. All right. Well, thank you so much for coming on, giving your time and sharing all your knowledge.
Well, that was great, Stu. Thank you so much. I'd love to hear more about the podcast. And thank you for doing that for all the community out there. This community needs organization support and information. And I love that you're doing that for them.
So there you have it. I really hope you enjoyed my chat with Katia, and all the resources and links will be on theocdstories.com/podcast. That's where you'll be able to find everything about this episode. So thank you for listening, and quick disclaimer, guys, this podcast is not therapy, it is not a replacement for therapy. Please seek treatment from a trained professional. Until we speak, take care.